Well, good morning, everyone. I'm Dr. Laura Leacher, and welcome to today's very special Medical Grand Rounds. As usual, we'll get started with some reminders and logistics and then get into introductions for today's speaker. Please be sure to join us next week. We will have the talk REM Archibald, Sleep and Sleep Issues in Later Life, given by Dr. Katie Drago from OHSU. I am here at Providence St. Vincent Souther Auditorium. Grand Rounds is now a collaboration between St. Vincent and Providence Portland Medical Centers. Often here live in the room on Tuesday mornings at 8 a.m. And Grand Rounds is also live at noon on Tuesdays, some days at Providence Portland. The weekly invite to Grand Rounds will always let you know exactly where we are meeting. Grand Rounds is always available on Teams Live so that you can watch virtually, and you can earn CME credit by being with us here in the room, by watching virtual live, or by watching a recording of the event. And the link to the Grand Rounds invite will get you to the video. I'll be monitoring the Q&A throughout today's session, so for those of you joining us virtually, please go ahead and post any comments or any questions, and I'll mostly hold those until the end as time allows. And now, introductions for today. Today is the 2025 Florence Edelson Memorial Lectureship, which was established in 2002 by Helene and George Edelson to honor the life and memory of George's mother. Her husband, Dr. Jesse Edelson, was a St. Vincent physician for many years. This lectureship seeks to bring an exceptional educational program each year, often with a broad lens of how we define and promote health and wellness. Today, we are joined by Dr. Ni-Cheng Liang, a four-time top doctor for pulmonary disease in the San Diego magazine Physicians of Exceptional Excellence. And she is the youngest and first woman of color to receive the San Diego American Lung Association Lung Health Provider of the Year Award in 2019. Dr. Liang received her medical degree from the University of Maryland, went on to complete internal medicine residency, as well as a chief resident year, as well as pulmonary fellowship at University of California, San Diego. She was recognized by Mindful Magazine as one of the 10 powerful women of the mindfulness movement in 2021, and graduated from the University of Arizona Integrative Medicine Fellowship in 2022. Dr. Liang practices general pulmonary integrative medicine and is also a mindfulness teacher for patients, physician trainees, and physicians. She brings a wealth of education and leadership experience. We are so delighted to have you join us today. Thank you.
Good morning, everyone. Thank you so much for that warm welcome, and I'm so grateful to be here. I'm going to jump right into our objectives this morning, and they're going to encompass mostly mindfulness and self-compassion with regards to definition, and then I'm going to present some data, and then we'll actually practice it, because I can stand up here and lecture all day, multiple days, but unless you actually try it, you won't really understand what truly self-compassion and mindfulness are. And so how we're going to get there, I have to lay the groundwork, though, of where we're at with regards to physician well-being, talking about healing, talking about the concept of the wounded healer, burnout, moral injury, and then our attempts at work-life juggling. So these are my disclosures. And as many of you have already been to many grand rounds, it starts off with a case. So this is no different. 31-year-old female physician. She's in her second year of pulmonary critical care fellowship, came back from maternity leave 8 weeks previously and was on ICU call. She got called back into the hospital to take care of a very critically ill patient with pseudomonal sepsis. This is the type of patient that if you left the bedside, he would have probably coded. She neglected all of her human needs for those 12 hours of taking care of him. The next morning, she stayed through rounds, went home, was able to rest, and then the very next day came back to work, but then was on call again. So lots of risk factors for her with regards to burnout. And not surprisingly, this was me shortly after my now 15-year-old was born. About 14 months later, after that picture was taken, I was diagnosed with stage 2 triple negative breast cancer in my second year of fellowship. I had to take a year off for 5 months of chemo, 3 surgeries, enrolled in a clinical trial. And while I attribute allopathic medicine to saving my life, it was integrative medicine approaches that helps me to this day survive and thrive as a cancer survivor. So it also is not lost on me that it's October and it's Breast Cancer Awareness Month. So this was not planned. And I think that the synchronicity is really special for me. And I'm really grateful to be here with all of you 14 years later. After being an integrative medicine patient, also while doing this clinical trial, what I used was acupuncture, Chinese traditional medicine, mindfulness-based meditation, yoga, and acupuncture to help with my own internal and external healing process. Coming back into the practice of medicine, I changed the way that I treated myself because I lived firsthand that really you cannot take care of others unless you take care of yourself first and foremost. And so it's with that of now over 14 years of experience of teaching mindfulness and some self-compassion later on that I'm here to you to share what I've learned and what the medical literature has also published on this. So I wanted to go back to the roots of an institution that we're in right now, and also where I frequented when I was an acute care cancer patient, going in and out of hospitals. The root word hospital, it comes from Latin origins, and it literally meant guest house. It was a place of welcome and it was a place of safety. In Mandarin Chinese, my native language, hospital is Yiyuan, and Yiyuan literally translates to institution of medicine. But the character Yi also means healing. So it could also be seen as a place of healing. And so can we bring that intentionality, that initial going back to the roots origin of what hospitals are supposed to be, what we're supposed to be as healers? We can be healing institutions within ourselves, for ourselves, and for those that we care for. And this is a painting of the first physician in China connecting with his patient, checking her pulse. And then we talk now about wounded healers. So the myth of Chiron from Greek mythology tells of the wisest centaur named Chiron, and he had an incurable wound. He was shot with a poison arrow by Hercules, and rather than become consumed with pain and suffering from this incurable wound, he transmutated that into mentorship and also healing. So he became very famous for healing others. The term wounded healer was first described by Carl Jung in 1951, and then the famous physician and Holocaust survivor, Dr. Viktor Frankl, as well as a lot of spiritual traditions around the world, notes that human suffering is part of life. It's inevitable, but that the suffering in and of itself can be meaningful and a framework for unifying the suffering of our patients with our own suffering that we've already experienced to come up with shared values and imbue your healing with even greater purpose and meaning. Another aspect of how we are all wounded healers is the danger of burnout. And I actually don't like the terminology of burnout because it implies this victim blaming mentality. But a lot of the physician well-being literature has published on burnout. And so Christina Maslach has defined it as 3 different components of emotional exhaustion, depersonalization, and a low sense of personal accomplishment. What I'd like to talk a bit about in getting to self-compassion and mindfulness is moral injury. And I think all of us have lived through a lot of moral injury, having been through the pandemic in some way, shape, or form. So moral injury, this term, is derived from the military. It is when there's a violation of personal codes of moral ethics that has either been witnessed or you've been a participant of. And so you basically are exposed to these potentially morally injurious events called PMIEs. And they could include all of those different reasons, like failing to prevent harm and witnessing or being involved with accidental or unjustified killings, betrayal, a lack of support. And it's when the moral injury becomes a syndrome, when there's ongoing pervasive symptoms like psychological distress, PTSD, and depression that's ongoing, that becomes very, very serious. Then moral distress is a short-term exposure and response to the potentially morally injurious events. But I don't want to compare what we went through in the pandemic to battlefield medicine, because it's actually really different. So in battlefield medicine, we have a common enemy in wartime. When we take care of our patients, they're not the enemy. We're doing our jobs, our calling as healers. Taking care of our patients, like that one-on-one interaction, isn't usually life-threatening. Also, oftentimes during battlefield medicine, our families and loved ones are not in that site of war. That being said, during the pandemic, it was very different, because when our patients were also diagnosed with COVID, especially during the beginning, earlier phases of COVID when the mortality rate was much higher, taking care of our patients with the lack of PPE was life-threatening to us. And so that created some aspects of moral injury. And then also, when you came home, you were in danger of bringing COVID to your family members. So how many of you had potentially like quarantine areas in your garage that you would shed your clothes and take off your shoes and jump into the shower before you even greeted any of your family members at that time? So I just wanted to bring out the harmful comparison between battlefield and the pandemic type of medicine that we all experienced. So COVID then became this magnifying glass for moral injury. There were a lot more unexpected deaths, not just amongst the vulnerable populations, but young people. Also, those patients who didn't have COVID had healthcare conditions that oftentimes were neglected, and then they died unexpectedly because of those. To name some of the things that were happening. Oftentimes we were expected to do more with less, see more patients with less. We also didn't necessarily feel very supported. There were a lot of conflicting messages that we were getting from governmental institutions that were supposed to be helping us. So the manifestations of moral injury are, I think, a lot more complicated than burnout. There's a lot of other difficult emotions like guilt, shame, sense of betrayal, and anger and disgust that can be part of moral injury as well. And the potentially morally injurious events in healthcare can include individual, organizational, systemic level, and they can still be happening today. And unfortunately, moral injury remains an occupational hazard in medicine. So some of the systemic level ones that resonate with me are misaligned policies between the business of medicine and trying to do what's best for our patients. So not surprisingly, being exposed to potentially morally injurious events with moral injury causes increased rates of burnout, distress, and reduced well-being. So risk factors include the lack of support, inadequate training, the lack of empathy. And then how many of you saw this image during COVID? It kind of went viral during COVID on social media. It was well-intentioned. We were painted as superheroes. We got claps in the evening. But the superhero analogy isn't fair to us, because we are actually humans with very human needs, not superhuman needs. We were also very vulnerable too. And so while this was well-intentioned, I also think that it's quite inaccurate. And treating patients as a pulmonologist through COVID was more like this, where I felt like I was walking uphill with this heavy load on my back while trying to breathe through PPE. So I wanted to give a shout out for the artwork that I am sharing with all of you, poignantly painted by my dear friend and colleague, family medicine physician, Dr. Saira Malik Rahman, and you can check out her artwork. She has painted a lot of aspects of medicine. I think that will resonate with you on a very deep level. So what's actually needed? Provision of psychological safety. I'm so honored to be presenting for the Edelson Lectureship, because I think this is one aspect where the culture of medicine can be changed, where there can be a psychological safety environment that's established very purposely, where you feel heard, validated, supported, and then to implement procedures where potentially morally injurious events are treated just like airborne precautions with pre and post-exposure prophylaxis. And how you do that is with education and empowerment. So there was a trial looking at a course that was only 4 hours long, teaching clinical leaders along with some refresher courses to have early regular contact, and taught them about empathetic communication. It also helped to basically support the employees by encouraging help-seeking behavior, particularly from mental health supports. The results showed that there were fewer mental health absences and lower moral injury rates. There's also this curriculum called the Mindful Ethical Practice and Resilience Academy, where it combined mindfulness, ethics, resilience, and work engagement as part of mitigating moral injury. So unfortunately, all of us will probably be exposed to some aspect of moral injury in our careers as healers. Can we think outside of the box and look toward our pastoral and chaplaincy colleagues for expertise in doing this with screening and further mental health support referrals? You can have interdisciplinary teams that are not just of clinician leaders, but also of spiritual leaders. Again, provision of that psychological safety that can include some peer support groups and trauma risk management groups. And then the therapies can be focused on cognitive behavioral therapy, mindfulness, and even restorative justice. So I follow this survey pretty closely every year because I do at least one well-being talk every year. And I want to give Medscape some credit because oftentimes this chart starts off with how many of you are burnt out. And so in the cohort, there are over 5,000 physician respondents, but this time they reworded it in such a way that it helps to upregulate positive attention bias. So this is really hopeful data. Can doctors in your specialty be happy and well balanced? So in the primary care world, family medicine's at 72%, me in pulmonary medicine, 69%, internal medicine, 66%, and the critical care, 65%. But regardless of the specialty, more than half of the physician respondents said that, yeah, doctors in my specialty can be happy and well balanced. So this is quite hopeful. And yet the reality, however, is that the burnout rate for physicians over the last 5 years or so has been around 50 to 53%, depending on the year. And so even in the last year, still roughly half of the physicians responding in this survey grappled with burnout and or depression. And so what can you do knowing that moral injury, burnout, increased risk of suicidal ideation are all higher for us in this healing profession than in other professions? All of you took some aspect of the Hippocratic Oath, right? You took some sort of oath, usually in medical school, maybe when you got your white coat. When I took the oath, it didn't include this addendum, and I'm really, really happy to see the addition of this phrase, and maybe take the time now to recommit and commit to yourself this prioritization that is happening finally, that you'll attend to your own health and well-being and abilities in order to provide care of the highest standard. And we're already doing that. So from the Medscape survey, 71% of physicians were already focusing on their own health and wellness as priorities. And this is older data from the 2021, but utilizing the pillars of health with exercise, social connection, sleep, but then maladaptive coping mechanisms made it on here as well, like eating junk food, drinking alcohol, binge eating, using prescription drugs, unfortunately. And so all of you are experts at taking care of you. No one else is going to know how to take care of you. But my question for you is, are you also prioritizing your pillars of health, like you're counseling your patients with getting enough quality rest, with stress reduction, with physical exercise, with socially connecting and eating a mostly anti-inflammatory diet? Unfortunately, 1 out of 6 physicians from the survey contemplated or attempted suicide, and we lose a little over 1 physician to suicide a day still every year. And there's a lot of different hotlines that are available for physicians who have suicidal ideation, but there's so much more that needs to be done, part of which is changing the culture of medicine such that physicians don't have to be afraid to share and seek help when they need it, especially if it's regard to thoughts of harm. So how are we to practice in a broken system? Despite all of this, we're here today. We're still healers, doing our best in a broken system. We talk about work-life balance. I actually don't like this phrase because it implies that in some magical point in the future, your work is going to weigh exactly the same as your life. When in actuality, it's just your life, all of your life. And so for me, and this is made courtesy by ChatGPT, the search terms and the instructions were pretty funny to put in, but this is me trying to juggle all of my work-related obligations as well as my familial obligations. I'm proudly in the sandwich generation where I'm caring for elderly parents as well as 2 kids, a sophomore in high school, yikes, and a second grader. So what can I do, having lived through cancer, to enable myself to be a healthy juggler of life? And so that's the question I pose for you. And I'm going to propose to you one potential solution is to heal mindfully. Healing others mindfully, but also healing yourself mindfully from potentially incurable wounds like Chiron. So healing is a movement toward wholeness and balance. A healer is an agent that supports the movement of system towards wholeness, and health is a manifestation of balance and connection within and across systems. And therefore, a mindful healer, though, then, is one who embodies presence to support oneself so that we can help others live in health and wholeness. So I hope all of you will be mindful healers. One mindful activity that I highly recommend in your potentially very, very busy clinical days is to check out the Friends of BigBearValley.org 24/7 nest cam of the Big Bear Eagles. Shadow and Jackie are currently preparing their nest right now. And so this is one easy way where you can instill a little bit of nature into your busy clinical day-to-day. They just recently launched their 2 daughters, Sunny and Gizmo. Very exciting. So that's Jackie up there. And Jackie's going to help tell us that compassion and mindfulness are 2 wings of the same bird. And yeah, so please check out their website. One of my favorite quotes by the late, great Maya Angelou: as you grow older, you'll discover that you have 2 hands, one for helping yourself and the other for helping others. So just not forgetting yourself in your circle of care as well. How can we do that? We can practice mindfulness. The definition is paying attention on purpose to the present moment without any judgment. A shortened version of practicing mindfulness is basically allowing the mind and the body to be here at the same place and same time. And how you practice it is oftentimes you have a focus of attention. Oftentimes it's the breath, and we'll actually practice it a little bit later. You bring your attention back to the breath because your attention will inevitably wander. That's what your brains were made to do, was to mind water and to upregulate negative attention bias, looking for different dangers. That's a protective mechanism, but you can retrain your brain to be mindful, just like you're exercising your physical bodies to potentially build muscle or increase your anaerobic or aerobic capacity. So you refocus back on the present moment, you observe your mind wandering, notice it, and bring your attention back, all of this non-judgmentally. And doing this hundreds and hundreds of times is where the practice of mindfulness happens. We know that from functional brain MRI imaging, mindfulness meditators had increased gray matter density in sites of compassion and empathy, and decreased gray matter density in sites of the sympathetic nervous system, like the amygdala, responsible for our fight or flight. At the time of publication, this was more of a theoretic slide with the potential mechanisms of action of mindfulness, but now after having done research for this talk, there have been over 16,500 articles now published in the medical literature about mindfulness. And so we know now mindfulness helps to upregulate positive cognitive states, also helps to upregulate positive physiological arousals like vagal tone or upregulation of the parasympathetic nervous system. It's inhibitory towards stressful cognitions and physiologically stressful states. Another interesting thing about mindfulness is that it's been shown to potentially be protective against telomere length loss. And we know that telomere lengths are responsible for chronic diseases as well as cancer, for instance. So perhaps mindfulness is the next anti-aging remedy. So amongst those 16,500 articles, there's a whole host of articles also published on the utility of mindfulness amongst those who have chronic medical conditions. For me in pulmonary, I've seen it be helpful, and the medical literature supports utility in asthma and COPD, as well as I see a lot of long COVID patients with chronic fatigue syndrome, as well as smoking and other addiction, and then the important comorbid diagnoses of anxiety and depression, particularly in COPD patients. And then this landmark study published in JAMA Psychiatry in 2022 showed that mindfulness-based stress reduction, which is the very standardized curriculum 8-week class, was non-inferior to escitalopram for treating anxiety. Years ago, when I did a Western ACGME conference workshop with my colleague, Dr. Johnson, she put together this slide showing that mindfulness helps medical students. A whole variety of different studies that have been done showing that improves self-compassion, self-care, reductions in perceived stress, decreases in emotional distress, reductions in anxiety, depression, and it has the capacity to increase empathy, so it could help medical students become better doctors. Landmark study published in 2009, bringing mindfulness into the clinician well-being world, done by Drs. Kratzner and Epstein, some of my old mindfulness teachers. So 70 primary care physicians took the mindful communication course. It was a 2.5-hour weekly class for 8 weeks with a 7-hour-long retreat day, followed by 10-hour-long monthly sessions for a total contact time of about 52 hours. And there were statistically significant improvements in mindfulness, empathy, as well as decreased characteristics of burnout, even a year and 15 months after the intervention. Similar study was done at Mayo Clinic in 2014 with about 19 hours of contact time with similar results as well. So since then, there have been a lot of articles published on the utility of mindfulness and well-being, along with other interventions to improve well-being. So this is the summary slide of all of those studies. And you can see that in the middle part, most of the studies were done on mindfulness-based interventions, and the vast majority of them had positive outcomes. Another one that I thought was notable for helping to improve well-being is something called job crafting. So job crafting is where the employee actually has a say in what their job description is. And then also gratitude journaling, I'm going to present data on. Meditation, so different forms of meditation, not just mindfulness, yoga, acupuncture, choir singing was on there, which I thought was fun, but it was a negative study, unfortunately. Maybe their N wasn't big enough or something. And then professional coaching, which I'll also present a little bit about. So in my world in the ICU, we also know that mindfulness helps to reduce burnout. So in the ICU teams, this study looked at an 8-week training program. And what was unique about this study was that it was app-based as well after the class. So there were daily reminders of practice in an app format. And it led to decreased emotional exhaustion from the characteristics of burnout, as well as an increase in self-compassion. Mindfulness can interestingly help reduce bias as well. So in 72 self-identified white college students that were randomized to 10 minutes of mindfulness meditation or natural history recording, there was actually less implicit bias seen in the meditation group. So what the mechanism of action was thought to be was that mindfulness helps you uncouple from your prior lived experience, potentially some internalized racism. So separating that from your reaction using that preconceived judgment and instead utilizing more objective responding. So I wanted to mention Professor Rhonda McGee's work. She's one of my mindfulness teachers, and I highly recommend this book, The Inner Work of Racial Justice. In the era of heightened racial tensions, we need to strive to practice anti-racist medicine or race-conscious medicine. And how we do this is we can do some pretty hard work by looking at how racism plays a role in our own lives, but then most importantly, to deeply listen and to be with those where racism is disproportionately affecting, like those from marginalized communities, and then to commit to take action, to act in favor of hopefully liberation at some point. I'm going to talk about the other wing of the bird now, which is compassion. And so self-compassion, though, is what I'm going to highlight on, because the United States, by and large, is much better at being compassionate towards others in terms of like national data. So self-compassion is a skill that we can all cultivate as well. And it's another way that we can recharge our batteries. So rather than becoming depleted in helping others, we can use self-compassion to also help us fill up our internal reserves so that we have more to give to those who need it. Again, we can't pour from an empty cup. So self-compassion, there's only about 4,000 studies in the medical literature, but growing every day. Includes 3 different components. Self-kindness. So can we use the compassion and care that we are all experts at for our patients and turn that care and compassion towards ourselves? The second aspect of self-compassion is recognizing that there's a shared common humanity in suffering and pain in life, unfortunately. That can be a moment of connection with the rest of humanity. And then the third component is mindfulness. So being open to what's here now and not catastrophizing and not using and falling into our tendencies for negative attention bias and magnifying problems such that they can be all consuming. When I was a resident, I definitely endured the Socratic method during rounds, and I had a lot of self-criticism when I couldn't get questions right when asked of me of my attendings. What if self-compassion were actually the motivator for learning and not fear? So the thought behind this is that self-compassion's driving force is love and not fear. There are 2 different aspects of self-compassion. One, which is the more yin aspect, the more tender aspect of self-compassion that is on accepting ourselves to alleviate suffering, whereas the yang aspect of self-compassion is more fierce and it promotes taking action, like protecting your boundaries and saying no, and then saying yes and providing for your own needs, and having the fear self-compassion become a motivating factor to help learn, grow, and help make the world a better place. And it's the balance between the tender and the fierce, the yin and the yang, that together can create a caring force so that you can thrive in your authentic, imperfect self. So self-compassion can help reduce burnout. In this study, the course Self-Compassion for Healthcare Communities is available from the Center for Mindful Self-Compassion. I took it. I highly recommend it. It's a great course. 116 physicians went through 6 weekly 1-hour online sessions and lots of different improvements in reductions in burnout levels, improvements in compassion satisfaction, reductions in secondary traumatic stress, as well as improvements in self-compassion, resilience, and job satisfaction. So all of you will be faced with moments of suffering, witnessing it, suffering yourself. There is a phrase that you can remind yourself in those moments by Dr. Kristin Neff, who's one of the pioneers in self-compassion research. So this is a moment of suffering. Suffering is part of life. May I be kind to myself in this moment. May I give myself the compassion I need. In addition to those of us in healthcare is the fact that you're not the cause of this patient's suffering. and to remind yourself of that. And still, you are trying your best to help alleviate the suffering of the patient, if you're able to. So, a word about gratitude. The 3 Good Things practice at Duke Medical Center had 228 healthcare professionals write down 3 good things that happened to them every day for 15 days. And it showed that there were increases in happiness, work-life balance, and decreased burnout and depression rates. And then a word about coaching. So Dr. Derby did this study looking at a randomized trial between a coaching intervention versus a control group. And in the coaching intervention, similar to executives having executive coaches, physicians can have physician coaches. The topics included optimizing meaning at work, integrating personal and professional life, building social support and community, improving work efficiency, addressing workloads, building leadership, pursuing hobbies, self-care, and then strengthening relationships outside of work. And the studies showed that there were statistically significant improvements in emotional exhaustion, overall burnout score, resilience, and quality of life. One I was missing. So we know that mindful practice with a combination of mindfulness and self-compassion can help with physician well-being, quality of care, and therefore the quality of caring. And so let's actually try some practices now. And all of these are optional. You don't have to do anything that I ask you to do, but I certainly hope that you'll try. And I'm going to ask you to silence phones or pagers if you're allowed to for a couple of minutes. And I'm going to ring some bells, and the bells are nothing more than the beginning and end of practice signals. So inviting you to close your eyes if that feels safe for you to do so, or lowering your gaze a few inches in front of you. And begin by noticing the support of the ground beneath your feet. Noticing the support of the chair or whatever it is that you're sitting upon. Knowing that that support is there unconditionally, you simply have to notice. And then inviting you to notice your breath at your nostrils. Noticing the in-breath, noticing the out-breath, noticing the pause in between. And acknowledging if there are any other thoughts, body sensations, emotions that are capturing your attention. Knowing that this is very normal for the mind to wander. And that you can notice the mind wandering and bring your attention back to your breath at your nostrils. And coming back to this breath. Next, I'm going to invite you to notice the sensations or lack of sensations along your shoulders. So the area that's at the base of the neck, noticing if they're somewhat elevated or tense, or if there's some pain or discomfort, or maybe there's no sensation there. That's part of your experience as well. Not judging it, just acknowledging that maybe that's where some tension can be held during times of stress, and inviting you to soften. Can you soften and allow the rest of your body to support that area? Next, inviting you to notice your jaw. So oftentimes there can be some teeth clenching without you knowing that there's tension in your jaw. So checking in with the jaw and inviting you, if you are noticing some tension, you can put the tip of your tongue behind the front of your top teeth. That sometimes can help neutralize the jaw. And then as you're ready, bringing your attention back to the breath at your nostrils. Not trying to change the breath in any way. Dropping any judgment about what you notice at the jaw and the shoulders. But coming back to the breath. Noticing this breath. And so as you're ready, blinking open eyes, letting the light back in. Thanks so much for practicing with me. And I'm going to segue now to bring in some mindful breathing. So this is another piece done by Dr. Rahman that resonates deeply with me as a pulmonologist. So box breathing is done by US Navy SEALs, actually. It's a training program for Navy SEALs where they need to have focus and calm. And so you can actually do the box breath with me, and you can draw your own box. So you can inhale through your nose, 2, 3, 4 for 4 counts, and then hold your breath for 4 counts. And then exhale through your mouth for 4 counts, and then hold your breath at the end of that exhale for 4 counts, and you've made a box. So this can be used for yourself or your patients when there needs to be some calm and focus. The 4-7-8 breath was made popular by Dr. Andrew Weil, one of my mentors from Integrative Medicine Fellowship, who was inspired by Indian yogic pranayama practices. I was interviewed by Mindful Magazine for this 12-minute practice, so you can check that out on their website. But basically the 4-7-8 breath is inhaling through your nose for 4 counts. So you inhale 2, 3, 4, hold your breath for 7, 2, 3, 4, 5, 6, 7, and then you exhale out through your mouth for 8 counts. 2, 3, 4, 5, 6, 7, 8. But I don't recommend the box breathing or the 4-7-8 breath for patients who have chronic lung disease, because the breath holds can be quite uncomfortable and it can actually slightly increase their PaCO2 potentially. So instead, I recommend the pursed lip breath. And I write about it in this article that I co-authored in the American Journal of Respiratory Critical Care Medicine that's freely available for your patients in the patient education series on the ATS website. And basically, pursed lip breathing is inhaling through your nose to fill up all the way, and then blowing out birthday candles. Dragging that exhale breath 2 to 4 times longer than your inhale breath. And what that pursing of the lip does is that it creates a little bit of positive end expiratory pressure to help splint open airways and help recruit alveoli for air exchange. It also has been shown to improve chest wall volumes and alleviates the qualitative sensation of shortness of breath, helps to promote relaxation. It also, if you imagine someone having an asthma attack who is hyperventilating and breath stacking, it helps to physiologically improve their breathing mechanics, and also helps to improve their sense of control in their breathing. With any of the breathwork practices, though, I highly recommend just only doing 3 to 5 breath cycles, because with pursed lip breathing, for instance, you can make yourself hypocapnic and get kind of pre-syncable and dizzy. So only 3 to 5 breath cycles for these mindful breathing practices. Also thinking about pursed lip breathing for not just chronic lung disease patients, but in patients who have dyspnea from congestive heart failure, for instance. In the study, there were congestive heart failure patients seen in the emergency room, randomized to either usual care with pursed lip breathing or usual care alone. And there were greater reductions in the qualitative aspect of dyspnea as well as anxiety in the usual care with pursed lip breathing group. And you can check out all of those breathing practices along with 3 other ones. I never thought I was going to be an AARP yet. I'm only 46, but I got interviewed for this article, and so I'm now an AARP. So the article is freely available for all your patients, and I'm very proud of it because they put together cartoon GIFs demonstrating all of the breaths, so easy for your patients to follow as well. Also, one of the great side effects about mindful breathing is that a lot of these breathing exercises can help lower blood pressure. So thinking about this for your hypertensive patients too. Okay, so some reflection questions for you. What do you notice having been through this experience? How do you see it affecting your own life and work? And what are your thoughts about embedding mindfulness and mindful self-compassion into your life? What are the barriers or challenges? And can our own suffering as imperfect healers, as healers who are wounded, along with the suffering of our patients who have their own wounds that we're trying to tend to and care for, can those aspects of suffering and woundedness be a mutual source of transformation and healing and understanding? I'm going to leave you with some resources. So some mindful mnemonics you can use or your patients can use. So in times of stress or difficulty, suffering, you're bearing witness to suffering, you can stop and let it rain. So stop, the acronym is stop, pause, take a breath. You can use any one of those mindful breathing practices that I just shared with all of you. And then observe. So observe by naming what you're feeling. So name to tame, naming your emotions in that moment of difficulty can actually help disarm the amygdala from going into a fight or flight response. Also noticing your thoughts as if they're clouds passing through the sky, not getting caught up in the judgment of them or storylines of them, but simply noticing them just as they are, as temporary chemical events that are happening in your brain. And then noticing your body sensations. Oftentimes in a clinical workday, we're oftentimes in our head all day. And sometimes we need to take a pause, especially if there's suffering that's happening or some difficulty, and notice what our bodies are telling us. Then you can proceed with greater skillful action and a response as opposed to an automatic reaction. RAIN is to recognize that a moment of difficulty is here and allow it to be here just as it is because it's already here. Resisting the reality of a difficult moment will bring on more resistance and suffering, unfortunately. So allowing that moment of difficulty to be here just as it is. Investigating similarly to the O and observe and stop. And then reminding yourself that the difficult situation has probably similarly happened before or will similarly happen in the future, and that you're not alone in traversing this particularly difficult situation. Probably hundreds of thousands or if not millions of people in the world at the same moment in time are having something similarly happening to them that is uncomfortable as well. So realizing that it might not be as personal as you're making it out to be, and reminding yourself that there's a shared common humanity in what you're experiencing. And then letting the N also be an opportunity for nurturing yourself. Like, what is it that you need in this present moment to help yourself? So other ways that you can incorporate mindfulness every day. So you can notice the sensations of the feet for that brief mindfulness practice that we just did, recognizing that you're always supported. You simply have to notice the support, the ground beneath your feet. Gravity is ever present here on Earth. You noticing your hands, the sensations of your hands. And then because I'm a pulmonologist, I think that breath sounds are like the most important part of the physical exam. And so at the same time, you can take stethoscope breaths with your patient. So as they're taking deep breaths in, as you're auscultating them, you can take some deep breaths in and out with them as well at the same time. You can mindfully eat. I'll say a little bit more about that. Do any of those mindful breathing techniques that I just covered. And then the faculty that I'm going to be working with after this talk will be going through mindful communication. And then something that I have started doing around the COVID pandemic was to make a point to walk outside in the middle of the day. So during my lunch break, actually taking a lunch break and going outside, even if it's just for 5 minutes. So 5 to 20 minutes. I'm from San Diego. Luckily, most of the time I can walk outside and notice, even if it's just walking in the parking lot, noticing the blue sky, noticing plants, noticing little critters, like I oftentimes see butterflies and bees. And I am lucky enough that I can walk and actually see the Pacific Ocean as well in the middle of my clinic day. So little things that add up to be self-compassionate for you that can build in moments of mindfulness that don't take a long time at all. The other thing is hand washing. I hope all of you are washing your hands many, many, many times during the day when you're seeing your patients. Those are opportunities to practice mindfulness. So noticing the sensations of the alcohol gel, the sweet perfume of the alcohol gel as it wafts up to your nose, the sensations of the gel, soap and water, paying attention to that and having that be an opportunity for some mindfulness. And then I don't know about it in Portland, but in San Diego, COVID rates are going back up again. And so donning and doffing your PPEs, that can be an opportunity for mindful practice too, like noticing the type of material that your mask is made of, the texture of the material, for instance. Okay, so mindful eating. When I was an intern, my senior resident told me to eat when I can, pee when I can, and sleep when I can. And that's not very self-compassionate. So I'm going to invite all of you, especially the trainees in the audience, to take 3 mindful bites when you have a meal. It doesn't have to be the entire meal. I know you have to like admit the next patient and answer that next pager phone call, but you can take 3 mindful bites of your food. And how you do that is you take some time to simply look at your food, notice the colors, the textures, and then when you put it in your mouth, notice the actual taste of it, the textures, the temperature. You can savor it by actually chewing it well, not just trying to scarf it down. And then shutting off your screens, your phones, just for those 3 bites, if you're able to. And then having a non-judgmental attitude about what you're eating, about, is this too fattening? Is this too fast? Is this not enough? Am I not doing this right for mindful eating? So dropping the judgment and simply being in the moment of enjoying your food and actually tasting it. There's actually really good literature about mindful eating with regards to portion control and enjoying and tasting your food better. You can also practice the self-compassion break. So all of you can do this right now. Think about a recent moment of suffering that you went through or witnessed. You can acknowledge that this is a moment of suffering. You can remind yourself that suffering is part of the human experience, that there's a shared commonality in what you experienced. And then have that particular experience be a catalyst to enable you to say to yourself, may I be kind to myself and give myself the compassion I need. And sometimes it's just some hand to heart. So hand to heart shown to help release some oxytocin from the brain. Also, you can do some gentle, respectable touch, like touching your cheek, giving yourself a self hug. That actually does something neurochemically that's of benefit for us. So the self-compassion break is something that you can practice day to day as well. And then you can also do some guided audio. So I was executive director for the Center for Mindfulness years ago, and we had guided audio and video recordings still freely available right now. You can join me at the Mindful Healthcare Collective. During COVID, I started a grassroots organization that now we've put on over 400 free wellness events on Zoom. Now it's mostly Dr. Jessie Mahoney teaching yoga weekly, but in the past we've done coaching sessions, other mindfulness sessions, had book clubs. And then check out the 10% Happier podcast and check out the Center for Mindful Self-Compassion website as well. You can also listen to me and Dr. Jessie Mahoney on our podcast called Healing Medicine. We're on every streaming platform. We just reached about 166,000 downloads. And at the end of every episode, we teach a 3 to 5 minute practice of mindfulness. Other resources include my own website with some free guided audio meditations, other apps for meditation as well. And you can go to and take an actual course. So mindfulness-based stress reduction is offered at OHSU. I just looked this up, or online, but I highly recommend that if you have the opportunity to do a mindfulness course, to do it in person. I think it's much more of a rich experience. You can also go to University of Rochester and participate in the mindful practice programs. They're actually offering a retreat later this month. This is through Drs. Krasner and Epstein. And then you can take the Self-Compassion for Healthcare Communities online class that I had referenced earlier, or take the entire 8-week mindful self-compassion course. And so in summary, unfortunately, burnout and moral injury are continuing to be occupational hazards in medicine that threaten our ability to successfully work-life juggle. But knowing this, knowing that we're all wounded healers in some way, shape, or form, enables us to connect with those that we care for who are also suffering and therefore help to heal others. Mindfulness and self-compassion are core components to becoming a mindful healer, to heal from within and to heal others. And that both mindfulness and self-compassion can be applied doing or not doing anything, anytime, anywhere, and by anyone. And I never miss an opportunity to quote Kung Fu Panda. So Master Oogway, who's the turtle sage, says to Po, the Kung Fu Panda, "Yesterday is history, tomorrow is a mystery, but today is a gift. That's why it's called the present." And I hope that I've shared information with you that's going to be helpful in your day-to-day life to help you more fully live in the present. And then honoring the late, great Jane Goodall. You cannot get through a single day without having an impact on the world around you. What you do makes a difference, and you have to decide what kind of difference you want to make. So thank you for the opportunity to be here with all of you. Thank you for all that you do as fellow healers. All of you make a huge difference in many people's lives. And with that, I'm going to close and happy to take questions.
Many thanks, Dr. Liang. I will open us up with a comment and question from our online audience. Some doctors often find that caring for sick people, even in difficult circumstances, is inherently rejuvenating and can balance out the emotional risks of that work. Do you feel that is a trap?
I'm going to ask a question of that question. What do you mean by, do you feel that's a trap? Like, what do you mean by the word trap?
I will see if we get a response from the online participant to further clarify.
I will make some extrapolations in what I think maybe the word trap means in this situation. I don't think so. I actually think that if you feel deeply rejuvenative in taking care of others, which I think in many respects, all of us are here because that fills our souls in some way. I don't think it's a trap. I think that you're setting the intention, you know a lot about yourself and what you like to do. It's when that ongoing suffering is witnessed time and time again. And then when that suffering is met with the business of medicine that comes into conflict with your own moral values as a healer, that's, I think, where a trap could potentially exist, where like potentially a catch-22 could exist. But the inherent compassion that we bring to others, we're already experts at that. So yes, that's my answer.
Thank you for the interpretation. I have a couple other thoughts and questions online here, but want to give a chance if there is a burning question in the room in the last moment or two that we have. We'll take one more online. We are facing medical nonsense affecting our medical practice coming out of Washington, D.C. on an almost daily basis now. How are you dealing with the stress that this is causing in our lives or your life?
Yeah, that's a great question. So part of it is that we have to realize that we can't control the thoughts and actions of others. And that's like a coaching tenet that I have to remind myself every single day, especially with the current political climate, especially with what's so-called quote unquote healthcare advice coming out of people who are not qualified to give. So what I have been doing has been focusing on what's in my locus of control. And that has been to do the best I can with taking care of my patients with evidence-based medicine, even though every day I'm met with so-and-so said this about this, that, and the other with no data behind it, but they don't know that. And so I acknowledge I do the stop in the rain very quickly in the clinic setting. And then I try to tell them objectively what's out there with regards to data or the lack of data. And ultimately, it's up to the patient to decide for themselves what they choose to believe or not, and what they choose for their health or not, including vaccines, unfortunately. It's a personal decision, despite all the excellent data that we have for it, especially in pulmonary medicine. So hopefully that's helpful.
Yes, thank you. Much more to unpack, no doubt, in this complex topic, but thank you for getting us started and providing some specific tools. We really appreciate your visit here to Portland.
Thank you so much for having me. Thanks, everyone.